4%. That is a staggering number. And that it means, again, the total number of deaths divided by the total number of people who tested positive. Now, it varies by country, and it depends how many people are tested, though. Well, in the United States, right now, it stands at about 1.4% mortality rate, and we're still ramping up testing, although testing is sky high now compared, of course, to the way it was just a few weeks ago. In Germany, where they've been testing 500,000 people a week, if you can believe it, the mortality rate is 0.5%. Now, it's critical to remember the WHO's figure leaves out, doesn't include people with minimal symptoms or who are asymptomatic. That means they didn't have any symptoms at all and just walked around undiagnosed. So figuring out that number is crucial to determining how deadly the coronavirus really is. So what do scientists think here? Well, this is from Dr. Fauci, who wrote last month, if one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%, and COVID-19 may ultimately be more akin to those of the severe seasonal influenza pandemic. Well, the seasonal flu's mortality rate is just 0.1%. So again, we've gone from possibly 3.4%, which is millions dying, to perhaps closer to 0.1%. See why it's important to let the data come in? Even CNN's Dr. Sanjay Gupta had to admit today that as bad as things can get, and they're getting pretty bad, especially in New York and some of these other hot spots, we do need to keep our perspective here.
The vast majority of people, even if you're elderly, aren't going to need hospitalization. The vast majority are going to recover. The vast majority are not going to die. So you're still significantly more likely to get through this than not.
Now, finally, the president dismissed the idea that he should just be in the White House hunkering down, meeting with his team, and not visit those who at this point, given everything they're doing for us, could actually use a morale boost.
Given that older Americans are advised to stay at home and avoid travel, is it absolutely necessary for you to go to Norfolk, Virginia tomorrow to wave goodbye to the ship?
No, but I have spirit for the country. I mean, we have sailors, we have doctors on that ship. I think it's a good thing when I go over there and I say thank you. It doesn't mean I'm going to be hugging people, and it doesn't mean that I'm going to be shaking people's hands. But I think it sends a signal when the president is able to go there and say thank you.
I think that answer was one of the reasons I was getting pinged all day long from people who are sometimes not the biggest Trump fans, or saying this was his best moment. Yes, you bet they need a morale boost. Got to be careful, but go be as close to the people as is, medically advised. The medical community, coast to coast. You think about the first responders. They're working in these hazardous conditions. They need our support. They need to see their leaders, state, local, federal, again, safe distances, and they need our prayers. There's going to be a time for a full analysis in the end of all this, after all of this is, I hope, behind us. Who was prepared, who wasn't, which mistakes were made, which weren't, which states responded properly, made the right calculations or revised them, and which didn't, and which projections were right and which were wrong. But already we're seeing that there is ample evidence at times to question the experts who had everyone freaking out that millions of Americans could be dead by summer. In the meantime, let's keep going in the right direction, move forward. And when necessary, if necessary, revise our data, revise our outlook, and revise our plans so we can restart our country at some point, we hope, very soon. And those are my thoughts at the end of America's shutdown, day 11. Now, joining me now is Admiral Brett Giroir, who's the White House Coronavirus Task Force member, Assistant Secretary for Health at HHS. Admiral, I need to ask you about this brand new study. I know you're not an epidemiologist, but